Well, hello everyone. Am I audible?
Yes.
Yes,
Thank you very much. I will start with my brief introduction. I'm Nadeem Iqbal, and I have done FCPS Pediatrics, FCPS Neonatology, MRCP Ireland, and MRCPCH UK. I welcome you all on the platform of MedPrep Online, and today we are going to discuss approach to the development station in MRCPCH exam, and we would specially focus on history taking skills and assessment of the fine motor skills in a development station. So, in development station, generally, when we are waiting outside the development station in the exam circuit, we have 3 minutes, and in the 3 minutes the candidate can go through the information sheet, and after that there are 9 minutes. During those 9 minutes you have to take the history, and examiner would introduce himself or herself and the role player, and provide you an introductory statement, very brief statement, and then you will take a very focused history. We will talk in detail about the history, how to take the history and everything. And after 6 minutes of the history taking, helper would announce you have 3 minutes left to gather your history. And after the 9 minutes, helper would move out of the room, and you will have to present the history in next 1 minute. So far, 10 minutes have been gone. And after that, examiner would give you the next command that would be to do the examination of the child, and you have to describe the development assessment process, and examiner provides dependent cues to candidate during the candidate's description of process, and you have to do the detailed examination. And when 3 minutes would be left, helper would actually warn you 3 minutes left, and after that, in the last 3 minutes, that would be the time for the viva, and during that you have to describe your findings of the examination, very brief description, and after that you will present your differential, your diagnosis, and then examiner would ask you further questions regarding the investigations and management, and then you have to respond to the questions. So this is a total 22 minutes, 3 minutes waiting outside. You have the time to go through the information sheet, and then 9 minutes for the history taking. And after 6 minutes, you would be warned 3 minutes are left. You have to compose yourself during the last 3 minutes, and then there would be 1 minute. And at that 1 minute, the role player would move out, and examiner would remain in the room, and you have to describe your history, very brief history. They like the brief history, and after that there would be 9 minutes for the examination, and at 6 minutes you would be warned again. The 3 minutes are left, so you have to compose again yourself. This warning is very helpful, and if there is anything remaining, you try to gather yourself, and then at the end, the last 3 minutes, you have to present your clinical examination findings, and then examiner would ask you question, what's your diagnosis and everything. So I hope I'm clear so far. And this slide is very important. You should, when you are approaching development station, most of the candidates face it very difficult, but actually it's very tricky, and you can easily get 12 out of 12 marks if you know the proper structure of the development station. So you should be familiar that examiner would be marking you in 6 domains. The first is information gathering and history taking skills. And then the next one is physical examination, and then identification of the clinical signs, and the next clinical reasoning, management planning, and your communication skills, rapport, and communication style. So the first one, in history taking skills, they would actually they would mark you whether how you are actually listening to the to the parents, and how you are properly gathering your information. And again, in physical examination, your examination technique, and how polite you are to the child. Definitely, these kids have some ongoing issues, so you have to be very polite and gentle. So it's not only like you are just asking a lot of questions, you have to be show some empathy. You should build some rapport with the child, build some rapport with the family, with the parents. Though there won't be any parents, but you have to behave like the role player is just like the person who is giving the history on behalf of of parents. And then after the role player will move out, the candidate, the examiner would still be in the room, and examiner is actually pretending like a child. You have to think like, consider in your mind that he is a child and you are dealing with this, and there is someone else in the room who is assessing you, and you are how empathetic you are towards the child, and what's your communication style, your rapport, and your overall skills. Okay, and this sort of scenario you will come across. Talk to Mrs. Elizabeth, mother of David, 4-year-old boy. Mother has concerns regarding his fine motor development. So do fine motor assessment as you would do in the real life with the examiner, and there won't be any real child. So when you are waiting outside the development station during the first 3 minutes, there would be an information sheet mentioning the history, just like this sheet. So, what are the important findings and important things that you have to note down from that information sheet? You should write down the name and exact date of the child. This is very important. When you are, sometimes the candidates are in a lot of stress. When they go inside, they forget the name and age of the child, and they ask the examiner. This doesn't give a good impression. And then you should actually know that document and note down the name of the mother as well, and make a very clear statement of what is your task. Sometimes they give, they are very tricky in the exam. They would give a long stem, and the task is mentioned at the bottom. So after then the third thing that you should note down is the task. And then the next important thing, make a short note of the background, important pertinent findings in the given stem. You have to get that stuff out of the whole bunch of the stuff. And then probably by this time you should finish all this thing in 2 minutes, and there would be the last 1 minute. That is for your planning and organizing yourself, how you are going to deal with this. You can make a impression in your mind. Some people say like you can write down the history points. It all up to your priority. I personally don't like writing all the history points, like sometime then you are moving the papers up and down, so you have to actually note down only positive things. I personally think the candidate should remember the history points in the mind very clearly, and then ask the relevant question and write down only very pertinent things that candidate is going to present. This gives a very good impression on the examiner that the candidate is mature and knows how to deal with the scenario. So next is definitely when you are going to approach the child, the most important thing is first you will introduce yourself. I'm Dr. Nadeem, and I believe I'm speaking to Mrs. Elizabeth, mother of David. I will ask a few questions and I will make a short note. Is that okay with you? So start with some opening sentence, and after that you will start with the presenting complaint, and may I know what is the concern? Mother will tell you the concern, and then the next thing you have to ask, when did this problem start? And after that, you should ask, is there any previously established health condition? I personally think if you ask the thing like this, any previously established health condition, so examiner will tell you if there is any underlying neurological problem or any other underlying any other metabolic or any other issues. They would give you, very wide spectrum of the cases. So make a very small and short and crisp question. And After that, you can ask, try to probe what is the underlying reason. You can ask like what happened around that time, when did this problem start? Was there any you can ask in the next question, was there any in fact any temperature, any head injury, any seizures or any other problem? And after that, the next thing you have to probe, is it only this domain or only this problem, or there is any global developmental delay? So you have to ask the next question, is this the only problem, or the child is or take the name of the child, or David is facing problem in walking, activities of the daily life, speech and socialization. So make it very clear in your mind. Never ask the question about the domain that you are going to assess. So in development station, you have to take the history and you have to assess one domain of the development. It can be either gross motor, it can be fine motor, it can be both gross motor and fine motor, it can be speech, it can be some social issues. So if my command is to assess the fine motor, I'm not supposed to ask about the fine motor skills. So I can ask about the about walking, running, gross motor skills, and about speech, about socialization, but I will not ask any question about the fine motor skill. If you will ask any question, examiner would stop you over there and would say like, you can't ask this, and it doesn't give a good impression on the examiner. And after that, the last question that you may ask is, has David lost any previously acquired skills? So just to rule out any regression. These are the initial question about the presenting complaint. And after that, there are a few other questions that I personally think which are very helpful. You can ask, is there any hearing or visual problem? Hearing testing has been done or not? And was hearing testing done at birth? Is there any recurrent ear infection in children with speech delay, or in children with the problem of the speech and hearing? Sometime there is underlying otitis media, so you have to ask this question. So it depends what is your command that you are going to assess. But I'm just giving you the point of the history, which are helpful in all the domains, and then you have to make your own notes in your spare time. And it's all about to ask the pertinent and very fixed questions of the history in case to case basis. So then you can ask about the screen time, spoken language at the home, and what services the child is linked with, and any investigations or treatment done so far, and what medication child is on. So services, investigations, and medication, these are also important thing. So if you will ask questioning, asking, one by one, lot of questions, so you should make a very crisp thing in your mind. Like in the beginning, you will actually make clear that what is the problem. When you ask, is there any previously established health condition? So then you have to specify your questions accordingly. So that is the first point of the history. In development station, you have to explore about the presenting complaint. And then the next thing, you have to assess the development domains of the child, only leaving the domain that you have to assess in your task. So it's generally recommended you have to ask 2 to 3 questions for every domain. Like if I'm going to ask about the gross motor, so I can ask, can he walk, run, jump? So always start with a question that is specific for that age. Like if child is only 2 year or 3 year, whatever is the suitable activity for that age, you can start with that. And then the next question, could you please describe the manner he goes up and downstairs? So that would actually complete your gross motor domain. No need to ask a lot of question. Candidate actually start asking a lot of question, and the time they take one minute for each domain. So it takes a lot of time, and you end up with short of time. Next thing is fine motor and VN. Any problem in the VN? Is he able to play with the cubes? And how tall tower he can build? So fine motor is you can ask about can he play with the cubes, how tall tower he can build with the cubes, and then you can ask next question about the crayons, what shapes he can draw. So these two questions would cover your fine motor thing. And along with the fine motor, generally vision comes if there is any command in exam to assess the fine motor. So you have to actually examine the vision of the child as well. And then along with the speech, there is association of the hearing. You have to address the hearing as well. Any concern regarding the hearing test done, it's all up to you. You can ask in the beginning or you can cover up here. It's all up to the candidate, whatever methods suits to them. So you can ask about the how many words and how many sentences he can make, he can speak, and body parts. Or you can ask about like is child aware about the name, age, gender. So it all depends about the age of the child. You have to start with a question that is more suitable for that specific age. Like if the child is 3 year or 4 years, so accordingly ask the question. And then if the examiner says or the role player says no, he can't speak that word or that number, then you can actually start with the lower task. And then socialization, does he play with other children? You can ask about the eye contact, dressing, undressing. So socialization, I generally say like you can ask question about the feeding, dressing, playing, and toileting. So it covers these four things: feeding, dressing, playing, and toileting is the way to cover the social domain. So I'm explaining you everything in detail, but don't get confused. Like it's a tough thing when you are actually doing your practice, and you will come with us in your face-to-face task. I think you will find it much easier. So don't worry about it. And then the next thing is you have to explore the birth history in detail. So you can start with the mother's age, and you can ask about any previous health condition or any new condition during the pregnancy, any diabetes, hypertension, thyroid disorder. These are important. And then you can ask any flu-like symptom or the skin rash during the pregnancy to rule out the thoughts. You can gently ask them about the alcohol and drug use. I'm sorry to ask, but it's important to be asked in this assessment. Did you consume any alcohol or did you use smoking during the pregnancy? Any medication use, and you can ask about the jelly scans, antenatal scans. So don't use the jargons. So you have to use the jelly scans during the pregnancy. Were they normal or was there any problem? And then there is birth history. Birth history, gestation is very important. What was the gestation and what was the mode of the delivery? Was it normal delivery or C-section? If C-section, was it an emergency section? And did baby cry immediately when he was born or needed any support? So this is important to rule out any HIE, birth asphyxia related stuff. And what was the birth weight? And then important thing is was there need for any admission or any investigation when baby was born? So it covers the things about the birth history. And then after the birth, you can ask like after the birth, was baby admitted at any point? And if there was need for admission, what was the duration of the admission? What investigations were carried out? Specifically, if child is admitted, try to focus on any blood test, did they reveal any infection? And ask about LP, jelly scans of the head or MRI. Sometime they have in their key, and if you don't ask, they won't actually give you marks. So try to, if the child is admitted, you have to ask these questions. And any specific investigation, what was the treatment given, IV, antibiotics, any breathing support. You can ask injections to cover the infection and breathing support, any feeding issues or feeding support was needed, was blood. changed for the child because of the jaundice or any other health condition. So you can ask about the newborn screening results and any increase in the head size, skin marks, skin rash, birthmarks, any issues regarding the blood sugar, jaundice, or seizures, and any established health condition. Like you can ask about the Down syndrome. Does the child look like mom or dad? So these are the important things to ask. And then the past history covers any chronic health condition, and number of admission, surgery, trauma, any medications, and teams involved. So it's all up to you if you want to cover here, or you can ask in the beginning. So it's all up to your convenience. So some candidates like here, but others like in the beginning. Regarding the family, you have to draw the family tree and ask about the consanguinity and family history of the children with some development problems or any other health issues, and history of frequent miscarriages, any other medical issues running in the family. So this is also important to ask. Social history, you have to ask about the financial support, about emotional support, school and education, and the services. So this is family history, and the social history is very important in the development history. So up till so far, I will try to recapitulate. Initially, we covered the presenting complaint and associated problems, and then we covered the developmental domains to be assessed. And then I asked about the birth history, and then past medical history, and then family history, and then this social history, and it has four components. If you will miss this stuff, family history and social history, I don't think so it would be a good impression. So you have to be very specific about your questions about the task. It's a time sensitive issue, so you have to do practice. A lot of practice is needed. And then about the financial support, you can ask, what do you do for the living? Are you happy with your finances? Any disability living allowance the child is getting, and how the child is um, 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 affecting the finances of the child. Any family stressors? Do you have satisfactory income? And who takes care of the child when you are at work? Perfect. And after that, emotional support is also very important. What kind of emotional support do you have? Are you linked with any psychologist, any sport groups, or health visitors? So these are important things to cover. You know, the families are going through a lot of emotional stress, a lot of financial burden. So you have to emphasize on these questions and try to address and just comment at the end if family needs any support like that. So schooling is another important domain to cover. Whether the child is in the mainstream school or some special school, is child needing any SNA, any special assistance in the school, and level of the sport of the child, one-to-one care or small groups, any educational assessment done so far, and educational healthcare plan. Services, actually, these children are linked to multiple services, occupational therapy, speech and language therapies. They are linked with a psychologist, children disability teams, and portage workers and respite care. So you have to probe about the services the child is linked with. Sometimes the children have very complex issues, some severe neurological background, like complex cerebral palsy children having the complex needs. Sometimes they have emergency care plan in place, so you have to ask about that as well. Emergency care plan, that is the plan actually in case the child end up in emergency in acutely unwell condition. So it gives actually clear plan about the resuscitation of the children, whether and there is actually meeting of the palliative team, with the parents, and then they make this plan. So there would be 1 minute to summarize. You have to give very crisp summary of the case, and always tell the positive findings only. There is no need to tell the negative, to tell all the story, because examiner doesn't like it, and you have to save your time actually. When you would actually fail in these exams, examiner has a key and you have to go to click all the domains, and if you are not saving your time, you are not giving a brief summary, you won't be able to complete all the tasks. So if you're not telling the management, examiner won't give you the marks for the management, and you will lose those 2 marks. So you have to divide it in 3 parts: cover the main complaint, and then you have to tell about the background history and any associations. So you have to, like, you can describe in a way: today I got an opportunity to take history of 4-year-old David from his mother. Mother has a concern regarding the fine motor skills, and then you can ask, next tell there is a background history. If there is anything positive in the background, you can tell about that. And the next thing I would like the candidate should tell, that there is no evidence of delay or concern about the other domains, and there is no history of regression. So you should be telling about whether it's a single domain problem or multiple domain problems, global developmental delay, and the second thing, what is the underlying cause, and then whether there is any history of regression or not. And then after that, the examiner would give you the next task. When you will actually explain your history in 1 minute, you have the 9 minutes, and you have to examine the child during those 9 minutes. So it would be a scenario-based task, and you have to do the task that is mentioned in the candidate information sheet. So again, most of the candidates actually feel problem here, and they don't understand, like, there is no real child, how they have to handle. But you have to actually presume that the child is the examiner is the child, and there is someone else in the room who is the examiner. So you should actually you can start this as examination task, like, I will enter in the room, I will wash my hands, introduce myself to the parents, and I will take the permission for the examiner. I will do the proper exposure. I will come to the level of the child and will build a rapport with the family and with the child. So this gives a very good impression for the examination in the beginning. And after that, you can start with the next thing. I will assess the child about any dysmorphism, any hearing or visual aids, and what is the posture of the child, any gadgets there, any wheelchair, any peg tube, or any other feeding issues, or any CPAP or BiPAP, or any breathing support over there. So the point is, you have to cover all these things, but you have to cover these things in a tricky way. When you are going to start after washing hand and building rapport, you will tell the examiner, I will review the David for his if there is any dysmorphism. Then you will have to ask the examiner, is there any dysmorphism? Examiner would say no. And then ask, is there any hearing and visual aid? Examiner would say no. And then you have to ask any gadgets, anything in the surroundings, any wheelchair or peg tube or anything. Examiner would say no. Posture and any you can say, I will check the growth parameters, check the OFC of the child. Sometimes the child has hydrocephalus or VP shunt. That is in their task. You have to address that. Any squint or any visual problems. So examiner would say accordingly yes or no, whatever the condition is there. And then you will say, I will prepare the toys to examine the child. and then I will, I will. Uh, what is David doing at the moment? Examiner would say, exam David is sitting in the corner, and then you will say, "Hello, David. How are you?" Then you have to ask, is he responding to me? So you have to, you actually pretend like that you are dealing exactly with the child. So this was actually a brief introduction how you have to approach the child. So always you have to do a good observation in the beginning, and examiner want to listen the questions, listen the things, all those things that you have to do during the observation in a real child. See the build of the child, head size, any unusual features, posture of the child, any special surroundings, and mention the examiner that I will collect the toys. And if the child is already playing with the toy, don't take away this, but start from there. And always try to engage and appreciate the child. So you can give the small, small appreciation comments like, "Well done, that's a nice job." So though it's very difficult to pretend like that, but you have to do, and this is the real thing. That's why I said, like, if you will actually try to understand what is this development domain and what is this examination and communication style, you can easily get marks 12 out of 12 in this station. I think so. I'm clear so far. And this is the list of the twice that you have to get ready. Sometime the examiner may ask you, though there is short time and they don't ask, but you should actually remember what should be there for your examination. Fine motor and vision. So fine motor refers to small and precise movements such as movements of hands. It can also include movements of small muscles of the face and mouth. Vision is important in hand-eye coordination and social functioning. So whenever there is a fine motor assessment, always address the vision as well. See in eyes for any possible squint, misalignment, any kind of visual defect, any visual aid, and check the eye by bringing any toy to eye level. So that would actually help to identify a squint. And start with task for that age and then plan further regarding the next plan. If child is 4 year or 3 year, then accordingly you have to, address your, accordingly manage your toys you're offering to the child. And then if child is unable to do that task, then you can step down to the lower age. So you may come across a child less than 1 year in the exam, like in at 6 weeks, the child can only fix and follow. 6 months, there is a good palmar grasp, and then they can transfer the objects from hand to hand. At 9 months, there is inferior pincer grasp. At 12 months, there is superior pincer grasp. I'll explain it in the next slides. And there are 3C and 3B in fine motor and vision assessment of the child more than 1 year. And 3C are the crayon and how the child play with the cubes, how the child cut the paper and builds a board and plays with the beads and opens the book. So regarding the crayon, you have to check for the hand preference and observe the grip of the child and see what child is drawing with the crayon. So hand preference is very important. When you are assessing a fine motor domain, in the beginning, you have to see like, I will like you can mention, I will observe for the VN and I will do the formal visual assessment. Is child wearing any glasses? You can ask, is there any squint? Examiner would say no. And then you will say, David, can you hold this crayon? And then ask the examiner, is he picking the crayon in the right hand or left hand? And that would actually let you know about the handedness, and that is very important. I will explain it next, and then you can ask, David, can you draw a triangle for me? And Like if he is unable to draw, then next David, I will draw this shape. Can you make the similar shape? And you have to draw a triangle on the paper. And if David is unable to do, then you can ask. I will ask the assistance from the mother. If he is unable to do, then you will step down the next shape that is at the lower preference. Perfect. So I think I have made my point clear. Like you have to offer something to the child and ask the child to do this, and then ask the examiner, can David do this? So this is the key. So regarding the crayon, about the grip of the pencil, it can be a fist grip in the beginning, 15 to 18 months, and that is the palmar supinate grip. If you have a look on the first picture on the left, thumb is at the top, while with advancing age, the thumb comes towards at the lower side. So that is the palmar supinate grip. And then the next is digital pronate grip, that comes at 2 to 2.5 year, and then quadruped grip at 2.5 to 3 year of the age. And actually that is the finger grip, and they take the help of the four fingers. And then next one is the tripod grip, that is a trying with three fingers tips. And it can be either static and dynamic. The difference between the static and dynamic is in the static tripod grip, that is at 3 to 4 year of age, the wrist is locked. They don't move the wrist, and they actually do all the movements at the elbow level and at the shoulder. While in a mature pattern, they actually move the wrist, and they do all the movements of the tripod grip um, at the wrist level. And after that, when you are playing with the crayon, you can offer a crayon to the child and ask, you can ask all about the possible shapes, about the whatever is suitable for the age, as I already explained. I will let you know, like they can do the scribbling to and fro scribbling at 18 months, and then they make some circular movements at 24 months. And you should actually memorize this word of LOXSTD, and L is for the vertical line, and it's a 2 year of age, and then the horizontal line at 2.5 year of age, and then circle at 3 years, cross at 4 years, square at 4.5 years, and triangle at 5 years of age. And then the next thing, you can ask um, you have to demonstrate the child to draw a man. Like you can draw a man, three part man, and you can ask the child, can you copy this? Can you make the similar stuff? And in actually three part man, there is only one circle is there, and legs are attached to that, and that's the only three parts shape. And in 4 year, there are five parts man they can draw, and head is attached to the legs with some details about eyes. And there are total five actually parts in that shape. And then at 5 years, they can add more details like arms, trunk, nose, and mouth, and total eight parts are there. So you have to demonstrate, David, can you copy this shape? And if he can't, then you will have to ask the examiner, can he make a shape? How many parts did he draw? Is it three part, five part, or eight part? Accordingly, you have to specify your question. And then cutting at two, then you have to offer a scissor. These are actually safety plastic scissors according to RCPCH guide. And they hold with one hand, and they don't cut anything at 2 to 2.5 year of age, but they can give only a single cut slash snip at 3 year of age, and then they cut in a straight line at 4 year of age, and then curved lines at 5 year of age. And then the next thing is building a tower of the cubes, how tall the tower is. So at 18 months, they can build a tower of 3 cubes. I generally remember by multiplying 1.5 into 2. So 2 times 1.5 is 3. So they can build a tower of 3 cubes, and um, 2 by 3 is actually 6. So initially one and half you have to multiply by 2, and then along for the 3 year, for the 2 year, 2.5 year, 3 year, and 4 year, if you will multiply with 3, the exact number of the tower of the number of cubes in the tower would come. Actually, uh, like for 2 years, if you multiply with 3, it is 6, and for 2.5 year, it's roughly 7.5, 8, and for 3 years it is 9, and for 4 years it's 12, and then for 5 years it's 15. And the additional thing, at 2.5 years they can build a train, like if the small they pretend to like a train, and at 3 years they can make a bridge, and then at 4 years they can make some steps. So again, you have to offer the cubes. You will tell the examiner, David, can you please make a tower with the cubes? And then ask the examiner, can he build a tower? How tall tower did he build? And then you can accordingly ask, can he make a train? Can he make a bridge? But you have to actually ask the David, can you make a bridge for me? And then ask the examiner, can he make a bridge? I hope I'm clear. And then for the boards, there can be, if you think of any question, you can leave the question in the chat box. We will cover at the end, and we will have interactive session at the end. I'm sorry, there are a lot of audience. We have unmute them. We would actually make it more interactive towards the end. But in our real scenarios, we encourage the people to ask the questions during the conversation even. And then when we come across the board, how to play with the board, it can be two simple shapes at 2 years, three simple shapes at 3 years, and then complex shapes at 4 years. And then the next thing is playing with the beads. They can actually put large beads through the string at 3 years and small beads at 4 years, and then they can actually move the large beads back and forth at 4 years as well. So you have to, like, you can tell the examiner, I will give a book to the David. David, can you open it? And then see how the David is opening. Like, if the child is 3 year old, there is some candidates, some examiners don't like because it's a milestone of 2 years. But you can ask, like, can you open the book one by one? If he's unable to open, then definitely his age is going to be lesser than even 2 years. So that was the initial formal assessment of the hearing and of VN and fine motor skills. And you would actually be warned at 6 minutes, and the last 3 minutes you have to quickly just try to finish the stuff. And at the end, when you complete this assessment, you have to say, I would like to complete my examination by doing the formal assessment of hearing, vision, assessing the other domains of the development, and reviewing the previous record of the child development book log. There is a red book in the UK, and there is a record of all the activities going on for the child. And I will plot the weight, length, and OFC on the centile chart. I will do the detailed systemic, and if there is need for a neurological assessment, you have to say the formal neurological assessment of the child. Yeah. So, what could be the possible causes for the developmental delay? There can be there's some syndromes underlying, could be environmental factors, neglect, lack of education, familial reasons. Autism is a very common cause these days, so this is also one of the um, cause. And if child is having some underlying complex issues like some gait problem or other thing, you can say some muscular dystrophies, myopathies, neurological conditions, cerebral palsy, stroke, post-meningitic sequelae, and metabolic causes. Accordingly, you have to actually specify whatever your case is. You have to do it accordingly. Fine motor can be part of the global developmental delay. Sometimes they can even say child with autism who could have the global developmental delay, and they can give you in the assessment of the fine motor skills. And similarly, sometimes if the child had some stroke or some tumor in the brain, and they can ask you to assess the fine motor skills. So there is a broad spectrum of the cases. You can't specify this case would come in the fine motor. It can be part of the global developmental delay. So make yourself very clear regarding that. So investigations, if the delay is less than 6 months or only 6 months delay, reassure the parents and keep in close follow-up. But if there is sometimes there is need for further investigations, generally the first line investigation is FPC, serum ferritin levels, CPK, thyroid function test, and accordingly urine for reducing substances, GAGs, genetic testing, microarray, CGH, and metabolic screening. But never actually do mention these first line investigations in every case. It's all about case to case based. Whatever your scenario is, you have to specify your investigation, and you have to give the clinical reasoning for that, for those investigations, because as I already explained you in the beginning, um, they have the marks, 2 marks for clinical reasoning as well. If you fail to justify any investigation or any multidisciplinary team that you are going to involve, what is their role, and they would undermark you for that. So make very clear choice of the investigations and the other colleagues that you are going to involve in the management, because they want you to be very specified about your selections. Second line test MRI brain in cases of microcephaly, focal neurological deficit, epilepsy, and management. So, so far we have covered the examination as a step as well, and covered the investigation. I would like to add here towards the end of the examination, when you are going to explain your findings, you can explain like, today I got an opportunity to examine 4-year-old child who was brought by mom because of the concerns regarding fine motor skills, and then you have to specify, is it a global developmental delay or other delays, and is there any regression. And you have to tell here the fine motor skills. Regarding fine motor skills, his age is this. You have to give a range of the development age. Never specify any 3 years. You can say 3 to 3.5, or 2.5 to 3 years. Under 2 years, this they would like to actually give a range of plus minus 3 years, and after that they would like to plus minus 3 months under 2 years, and plus minus 6 months after 2 years. So you can say like the estimated formal on my formal assessment, the fine motor age is 2.5 to 3 years. And then you have to explain here, because he's able to do this and he's unable to do this. So when you are asking the questions, make it very clear in your mind, like try to estimate the age of the child over there, because you have to actually justify and give some fine motor skills age at the end. And then you have to explain the positive things on your in your description of the clinical examination, like if the child is having any squint, any visual aid, or any other underlying health condition, you have to manage, you have to specify that. Perfect. So this is the way to tell towards the end, but at the end you can say I would like to complete my assessment by reviewing this about the previous health record and assessment of the other domains. So management, they really like to listen from you the word of multidisciplinary management, um, um, and then children disability team and child development child development center, developmental team, and community pediatrician. These are the three mandatory things that you have to fit in every child of that development. But if the child is having only possible speech delay, then only speech and language services would be needed. But if you think child is having some other things, then some complex sort of stuff, you have to refer to the child developmental center and the developmental team. So MDT team is actually comprised of a developmental pediatrician, ophthalmologist, ENT, cardiologist, neurologist, psychiatrist, psychologist, geneticist, and neurosurgeon. So it doesn't mean you have to include this multidisciplinary team in every case. It's all about case to case based. You have to specify your answer, and you have to give the clinical reasoning why you are selecting this thing. And then allied team, physiotherapist, occupational therapist, orthotics, dietitian, speech and language therapist, and then ophthalmology and cognition, CBT, cognitive behavioral therapy. So you should be very clear why you are referring to these domains. It's better to be very specific in your answers. School sport, you have to address the children's who have some complex issues and they need some school sport, and special educational need coordinator and educational psychologist make the educational healthcare plan of the child in UK, and that is an education and healthcare plan for the children and young people who need more support than is available through special education needs support. So it plays an important role and identifies educational, health, and social needs and set out the additional support to meet those needs. And portage, worker, any home modifications according to the need of the child. So social support, there is always social worker available that you have to link these children, and that social worker is very important to link the children for other services, and they play a very vital role in the community. And if the child and the family is having some financial issues, they are entitled for the disability living allowance. You have to coordinate with the relevant disciplines and fill the relevant forms for them. So I hope I'm clear so far, and I tried to cover all the domains of the history and examination. And any questions?
Sir, what is the portage care and respite care?
So very good question. The respite care is actually sometime the children who are having complex needs, their family is going through a lot of emotional stress and financial stress. So there is a team in the community available that provides actually care for the child. There are different homes where actually the children, they can drop the children and the respite team over there mind them, or sometime the community team also comes to the home of the children, and they actually provide the care at home, and then the children and then the parents could have some spare time to perform the other activities. They can take rest and they can mind the other children. They can do some outing. Actually, all these sports are actually to support the family who are going through a lot of stress. And then portage, worker, these children need actually transportation problems, and there is need for some home modifications, and these all sports in the community actually help them to make their life easy, to facilitate the child and to facilitate the family. Am I clear?
Yes, sir. Thank you.
You're very welcome. Any other questions? No questions generally.
Um, I have
Yeah,
question. You
yeah,
you told
sure.
me about the age, the variability in the development age below the 2 years. You said 3 months, or you 6 month range for the
So
developmental age.
yeah, good question. I try to answer this thing. If the child, if you think the developmental age is under 2 years, then you have to give a range of plus minus 3 months. Like you can say the child is 2 year, 1.5. If you think the child developmental age is 1.5 year, you can either say 15 month or 18 month. Okay. If you think 15 month, you can say 15 month or you can say 18 month. So never give only specific age. You can't say like 1.5 year. You can say 1.5 plus minus 3 months, either 15 month to 18 month, a range over there. And similarly, if the child age is developmental age is more than 2 years, you can give a range of plus minus 6 months, because you are actually assessing only one domain, and you are not going to assess all the domains. So they like to actually listen a range of the age at that spot, at that point.
Got it. Thank you so much.
You're very welcome. Any any more questions? I think you should ask maximum questions, just make to clarify all your queries.
Yeah, yes, sir. You told about mnemonic for crayon. How to ask? Can you please repeat that?
So yeah, sure, I can. About the crayon, yeah.
Yes, yes,
So
yes. This one.
is this a slide, yeah?
Yes, yes.
So if you remember this mnemonic LOXSTD in your mind, then it would be actually easy for you to ask the question. So what you will ask, like you will ask David, can you, like if the child is 3 year old, then what you are going to do, you will draw a circle, and you will actually ask David, can you draw this shape for me? And if then you will ask examiner, can David draw a circle for me? If he can draw, it means that the child is having age of 3 years. And if he is unable to draw, then you can ask David, can you draw some line for me? Then you can ask the examiner, can you draw a line? Is it a vertical line or horizontal line? So examiner knows, like you know how to approach the child. And if you are going in a right way, examiners are very sportive. They would support you and they would give you answers. So this mnemonic is just to remember the appropriate milestone for drawing with the crayon. Like if you have a look on this L, it's a vertical line that is at 2 years. This horizontal line is at 2.5 years. This circle is at 3 years. This X is the cross at 4 years, and then S is a square at 4.5 years, and then this T is the triangle at 5 years, and then D is the diamond. They can draw a diamond at 6 years, more than 5 years. So you, if you remember this, this would actually help you to ask the relevant question. Like if in your exam the fine motor assessment is for 5 year old child, you can ask like uh, um, I will give a crayon to the David, and then pretend to make a cross in on a page, and then ask David, can you make this shape for me? And if then ask the examiner, can he make a cross? Then examiner would say yes or no. If no, then you can ask, can he make this shape? That is the O shape, that is a circle. So that would actually facilitate you and help you to ask the relevant question, just to knock down the scenario, and just to remember what are the appropriate milestone for playing with the crayon. Am I
So
clear?
yes, yes. If child is 5 year old, so we will start from 4 year,
No, if child is 5 year
one
old,
year
you will start with the 5 years
from the 5 year. Okay.
from the five
If
year.
then we will
Yeah,
ask from the triangle. If he will not able to draw triangle, then we will ask about the square.
definitely, definitely.
Okay. Then we will decrease step by step. Okay. Okay. I get.
Step by step, and then
Yes.
if you remember this thing, then you would be if the child end up here, like child is 5 year old, but he's unable to do
Yes.
this, and he can do this. So it would give you clue. This is a very good thing, the crayon, and you can make an estimated age of 3 years, and then you will go to us
Yes.
to identify them playing with the blocks and all that stuff.
Okay. I get. Thank you so much. Thank you.
You're very welcome. Try to ask more questions.
So in all domain, we will ask about according to age, and then where is the delay we can pick from this that child in this area child is not able to do this thing, so
Mhm.
he will fix on that area. It is like this.
Exactly. And you have to make if like as we discussed, like child is 5 years and is unable to make a triangle, unable to make a square and cross, but can make a circle. When at the end of the examination, you will tell the examiner that the estimated age for the fine motor skills is three years. They
Yes.
would really appreciate if you specify over there like because he was able to do this but unable to draw a cross, square and triangle. So his age is 3 years. Even if you will say like his fine motor skills age is 3 years, examiner would ask you the next question. Can you please explain how do you think so? So then you will have to explain this. And this is the thing they call it clinical reasoning, and they have to give you marks, 2 marks for
Okay.
that. If you're very
Okay.
clear in your clinical reasoning, they will give you 2 marks. If you're borderline,
Okay.
they will give you 1 mark. And otherwise, if you could not justify it, they would unfortunately give you 0 marks.
Okay. Thank you for a good explanation.
No, no, you're very welcome. I really appreciate the questions. So try to ask the questions. So at end of this session, you should be very clear how to approach the history, how to approach the examination. If you understand the basic technique for this station, trust me, you can easily get 12 out of 12, 12 out of 12 in this station, and every mark actually matters. So try to be very focused about your questions, about your approach, and when you are explaining, telling the history, the three things which I told you, like you have to address them. Don't tell too much details. Try to save your time. Try to move forward. Even if you explain your history thing in 30 seconds, you have saved your 30-second. Examiner would actually suggest you to go and move forward towards the examination thing. And then do a quick examination. Try to save the maximum time even before the end of the 9 minutes so that at the end you should have some ample time to go through the management about your investigations, about your reasoning and all that stuff. Sometime if you're going in at a good pace, examiner there would be like 2-3 minutes still at the before the end of the station, and examiner would say you like it's all right. We still have 3 minutes. If you want to say anything, you can share, but otherwise wait for the bell. So save your time. Don't give too much details. Try to ask very focused questions. Try to give very focused description and save your time, energy, and temperament. Are we clear? So is there any candidate who want to take a voluntary history? I can give you task and you can actually take a very focused history and do a examination, and I will do some corrections. Nobody there.
Okay, doctor, I can do.
Perfect, very good. What's your name? Introduce yourself.
My name is Dr. Isra, and I'm going to do fine motor assessment today for Mrs. For David.
Very good. So you have 3 minutes, and
Yes.
in these 3 minutes, you have to make your short notes, go through this scenario, and then we will start.
Okay, sure. Thank you.
Sir, can I ask one question?
You want to ask question?
Yes, sir. I want to ask one question.
Yeah, go on.
Sir, if patient is a 5-year-old, but he do not draw the triangle and the square, but he can draw the cross. So we can go below like he can draw like the circular knot, yeah, or we have to just stuck on the cross like at the age of the 3 year or 4 year.
So if the child is 5 year and is unable to draw the relevant shape for that age, you can ask the next question for the 4 year, and if he's unable to do that, then you can ask for 3 years. So
But
accordingly, you should go up and down.
But he is able to draw the cross like at the age of the 4 year. But he do not like, so I go down like you can draw a square like the circular knot.
Oh no, if you think like he is able to do a cross for 4 years, then you can take that age as the fine motor age and then move to the next thing. Don't ask about the crayon any further questions.
Okay, thank
All
you, sir.
right.
Yes, sir.
Very welcome.
Okay, doctor, I can start.
Perfect. Thank you. Go
Okay.
on.
Yeah. Good evening, Mrs. Elizabeth.
Hi. Hello.
Hello. Can you hear me?
Yeah.
Yeah. Good morning. Good evening, Mrs. Elizabeth. I'm Dr. Isra, one of the children doctor here. Nice to meet you.
Thank you.
Mrs. Elizabeth, I'm here today to discuss with you regarding the condition of your son, David. I will take some notes down, if you don't mind.
Thank you, doctor.
Mrs. Elizabeth, may I ask you what's your main concern regarding your child?
Like my child is unable to perform the activities of the daily life when I compare him with his peers. I think he's lacking in that.
I'm so sorry for that, Mrs. Elizabeth. So when did you start to notice that?
Well, I noticed it like since the beginning. He is not like he's not like his peers. Like he has some problem when he actually try to write, and he can't make proper shapes as compared to his other peers. And there are some concerns from the preschool that I'm facing.
Okay, Miss Elizabeth, we will try to solve this out. Okay, may I ask you, what did you do for that? Did you seek medical advice
Well,
before?
I actually did discuss with my GP, and GP has sent a referral to the consultant. I shared my ideas. I shared my concerns to the GP about the preschool teachers.
Yeah, did they do any support for your child at the school?
No, there is no support so far.
Okay, so Mrs. Elizabeth, does David have any long-lasting condition or any medical problem?
No,
Does he receive any medication or following with any team?
no,
Okay, did he lost any other skills he used to do?
no.
Okay, good.
Well,
This is great.
he
Yeah,
he didn't lose any gained skills like but I'm concerned about his skills overall.
yeah, it's clear. Sure. So, Mrs. Elizabeth, do you notice that any abnormal behavior, like any rigid routine, any tantrums?
Yeah, sometimes he becomes very aggressive and he shouts and screams. This is what I have noted.
So, can he play with other children, or he has an isolated play?
He likes to play on his own.
Okay. Does can he express his needs? He can.
Sometimes,
Okay. Does he has any obsession with certain toys or certain food?
um, not really, but he's specific for some of his toys.
Okay. So, Mrs. Sama, do you have any concern regarding his vision or hearing?
No, doctor.
Yeah. Does he look like you or his daddy?
Yeah, he's more like me. He's more like me.
Oh, great. So, Mrs. Elizabeth, I will ask you a few questions regarding his past history. Does he had any like head trauma or any insult like infection
No,
previously?
doctor.
Okay. Does he have during while you are pregnant with David? Do you have any problems while you pregnancy?
Not really.
No fever, no medications,
No.
and you did jelly scans while you're pregnant. It was normal.
Yeah.
Oh, good. I'm so sorry to ask, but it's just a routine to ask about alcohol intake or smoking or any drug intake during pregnancy.
No, I tried my best to avoid that, but occasionally I did use it. But I was very concerned about the pregnancy, so I was mindful of that. It
Oh, thank you for that. Okay, Mrs. Did when you delivered your child, he was on date or before date?
was 38 weeker.
This is good. And he did he need any assistant after birth or like in breathing?
No, not
It
really.
was good, and it was small delivery, no issues.
No issues. Yeah.
Okay, after birth, does he need any admission in the period after birth to the PB unit?
No.
Any concern like fever, any fits or um, jaundice?
Well, there was no jaundice or any other thing. He was okay after the birth.
Oh, this is great. So, and the screening test after birth, did you follow with the team?
Can you say it again, please?
The screening test, like his screening for heel break and
Yeah, that was fine. That was
it
fine,
was
doctor.
okay. This is good. Mrs. Elizabeth, I want to ask you regarding is he able to walk and jump? Well,
Yeah, he can.
he can. And can you describe to me how he's walking, climbing the stair up and down, like the adult, or no?
Well, he just like the normal child, he can go downstairs one step, 1 foot per step.
And go up as an adult? or
just
one
like
by one?
adult.
Okay, good.
One by one, one by one. Yeah.
This is great. So, regarding his speech, how many words he can say, and can he formulate any sentence?
Well, he can formulate sentences, two-word sentences, really.
Only 2 words.
Yeah.
Does he know any rhythm, or can he tell a story?
Uh, there are 6 minutes, 6 minutes gone.
Sorry. Yeah. So, regarding yeah, his play, can he join other children in a play or no? Oh, sorry, you have told me that he has preferred to isolated play. So I will go for. Can you describe to me your family?
So he's the only child.
He's the only child. Any consanguinity or any relation between you and your husband?
No,
No, good. And do you have any previous abortions or similar condition in your family?
not really, doctor.
Okay. Can you tell me if your child is attending school or not?
He is attending school, yeah.
Yeah, mainstream or special school?
It's the special school.
It's a special needs school. Okay. And
Yeah.
how he's doing at the school?
Well, he's doing good. The teachers are a bit concerned. He actually there are quite good concerns about his behavior, and he's unable to write properly, and he doesn't like. But as he's in the special school, there is some good assistance over there. So I think he's doing good than before.
Oh, this is great. So, Mrs. Nadia, I want to ask if you have any like stress or any we are facing any social problems.
Yeah, I'm facing some social problems, definitely, doctor.
Can you tell me like what?
Like he is having some emotional disturbances, and there are some emotional issues. Sometimes I personally feel as well.
Yeah. So, what about the finances? Do you have any problem or financial issues?
So finances, we are okay.
This is great. And who could take care of your child if you are not at home?
Well, there is a grandma at home who minds the child.
Okay, this is great. And okay, do you have any other concern, or do you need to tell me anything else?
No, thank you, doctor.
Okay, thank you, Mrs. Elizabeth. Now, I will go to assess David after your permission, and of course, will come back to you at the end.
Here, I think you will stop here. We will try to make it the real scenario. So you are finished with the history, and this would be the point where the helper would go out of the room, and then examiner would ask you to describe your findings in 1 minute.
Okay, so today I was able to take the history from Mrs. Elizabeth about David. He's a 4 years old child. Her main concern is that David is unable to perform the daily activity, and he has a concern at the school because he's not able to write well, and he has some difficulties with crayon, using the crayon, and playing with the cube. The condition was started early with the development as he was developed. As a child has some behavioral problems like tantrums, and he's aggressive, and he obsessed with some of his toys, and he has some difficulty in expression of his need. And that child, one moment. The mother, she's facing some social and emotional disturbance because of this concern. Um, there was no significant in the history other than that. And he is attending to a special education school. He's receiving a special education school, and he's getting assistant at the school.
Perfect. Thank you.
Thank you.
So at this point, Examiner would actually tell you that you have to do the very focused examination of the child, and you have 9 minutes to examine the child and then present the findings. So your time starts now.
Of course. Mrs. Elizabeth, after your permission, I will examine David. So I will go and see David. So I will say first, hello, David. How are you? And I will observe if David can notice my entry and give me any eye contact.
Well, notice David is actually sitting in the corner and didn't notice you actually.
Okay, I will try again to engage him and then say, hello, David. How are you? My name is Isra. Can he give me any eye contact?
Yeah, he had a freaking eye contact with you, and then he started playing again.
Okay. What is David doing right now?
So he is sitting in the corner and is playing with the cubes.
He's playing with a cube. I will observe for David to see if he's has a well-built body or any dysmorphic features.
So there is no dysmorphism.
Okay, and he well-built for his age?
Yeah.
Good. Any attached devices, any eyeglasses or hearing aids?
Well, he's not having any aids actually.
Okay, great. So I will go and approach David. And David, hi, can I play with you today? Did he show any interest?
He is not really very interested.
Okay, I will try to approach more and I will try to play with the cube with him. And I will give him one cube in his right hand and one cube in his left hand. I want to see the eye alignment, if any squint, any nystagmus, or no.
There is no squint.
Okay, can he take the cubes by both hands?
Yeah, he can take in both hands.
Any hand preference?
No preference.
How is the hand grip? Does he have a mature hand grip?
Oh, hand grip is fine, not too bad. Yeah.
Okay, good. David, right now let's play with the cube and I will make a tower. Can you make a tower, the most highest tower ever? So I will observe if he can build a tower and how many cubes he can build.
So he can build a tower of 9 cubes.
Okay, great, David. Thank you. So I will introduce now paper and a crayon and to try to engage him. Let's David now try to draw something and I will give the crayon to his hand and I will observe how he's holding the crayon.
How he's
So
holding the crane, yeah?
yeah, can I know how he's holding? What is the position? It's should be tripod position, is it?
Well, it's a quadruped grip.
Quadruped, great. So, David, let's draw. I will draw for you this square. Can you copy me? Can he draw a square?
He can draw a square, yeah.
Yeah, this is great. So, I will draw like a man, so formed of 4 parts. So, David, can you copy my man? Can you make the same one? Can he do it?
No, he can't make 4 parts.
Can he how he can make 3 parts only?
Yeah, he can make 3 parts.
Okay, good. So I will introduce now the scissors. So David, if you can hold this scissor for me and try to cut this paper, and I will observe. Can he hold the scissor well and cut the paper?
Yeah, he can hold, but he's not following the command to cut the paper.
Okay, and he can use it, or only hold it.
Yeah, he can't use it, yeah.
Okay, good. So I will introduce a book which is full of colors. See, David, this nice book. Let's turn the pages together, and I will try to turn the page and see how he's turning the page. Can he turn the pages? But one
He
by
is
one?
turning the page, few of the pages one by one, but rest of them, few good number of the pages in one go.
Okay, good. I want to introduce now the beads and see how if he can do it. David, I will do these beads like this. Can you follow me and do the same? Can he do it through and through or no?
No, he can't follow you actually.
He can't do any?
Yeah, he's unable to follow you for
Oh,
passing the beats to the string.
okay, so I will get a simple puzzle and a complex puzzle, and I will give one shape in his right hand and another one in left hand, and see. Can you, David, put this shape in its place? Is he able to do by both hands or no? In the simple puzzle.
Oh, he can do that.
Okay, good. I will go for the complex puzzle, and I will give him two shapes as well. Can he do it?
Say this question again.
I will bring the complex puzzle and I will give
Oh,
him
he can't
another
do the complex.
two.
He can't do the complex one.
He
So
can't
your
do.
6 minutes
Okay.
are finished. So 3 minutes
Yeah.
left.
Okay. Um, okay. I want to. Yeah, I want to observe if Adil has any like he's able to share a toy with me or no. I will try to share a toy and take one of his toys. Is he accepting or no?
So he's accepting the toy.
Okay, good. Um, so I have finished my assessment.
Okay.
So today I have assisted David in a 4 years old child regarding his fine motor domain. And actually, I would give him the age of 2.5 to 3 years old because at most of the domains he was able to do only nine cubes tower, and he was only able to do simple puzzle. He was not able to do the beads and was not able to use the scissors and was not able to draw a man formed of four parts. Actually, David, his chronological age is 4 years, but I would give him the age of 2.5 to 3 years.
Okay, doctor.
Okay.
So
And
yeah.
yeah, on assessment of Adil, actually Adil was sitting and didn't show interest in me while I'm entering the room, and the eye contact was not fully developed, and he was a little bit not interested in fully engaged in the play with me. Um, Putting all this together, I would say that Adisa have some behavioral problem in, and I want to assess him regarding any features of ASD.
Okay.
Yeah.
Think what is your diagnosis?
So this is a case of uh, actually a global developmental delay with a psychiatric or with some behavioral problem. Um, my differential diagnosis can involve something like a syndromic problem or something like neuropsychiatric problem like ASD. Might be something problem genetic or metabolic problem.
Mm-hmm.
Um,
So what's your top diagnosis, doctor? What's your most likely
um,
diagnosis?
yeah, actually, the most likely diagnosis might be it's related to autism spectrum disorder. But I'm
Perfect.
not.
That's fine. And how will you investigate this case?
So I would first of all, I would like to assess the other domains carefully and fully, and I would like to examine my child and plot his measurements. And I would like to refer the child to the developmental team and developmental center. And I would like uh, to revise the record of the child and after discussion with my consultant and my senior to consider if he needs for any investigations if it's not already done, and of course I will involve a team.
Okay. And go on.
Yeah, I will involve a multidisciplinary team formed of the pediatric consultant, the developmental consultant. We will need, of course, the occupational service. We might need, of course, the social, the speech and language service. We will need to do formal vision and hearing assessment for David, and we will need involvement from the social worker and the educational psychologist and the educational healthcare plan.
Perfect. And doctor, what is the role of occupational therapist in this case?
Yeah, actually, the child, as he has some problems in the fine movement of the hands, the occupational service might, he will help him in the training, and he might do some modification and for better use of the fine motor and assess the problem.
Perfect. And what is the role of educational psychologist?
Yeah, because as a child has some problems in like behavioral problems, and he's difficult to engage with other children. As a child currently as a school, and he's not engaged as a school, so educational psychologists will help as a school in assessment of the child and in helping him at school.
Thank you, doctor. Your time is finished.
Thank you.
Okay, very good. So, what do you think? How did it go?
I don't know. I think I'm was struggled at the middle. I didn't know what exactly the diagnosis. I feel like I'm confused. So
Mm.
I don't know. There was no specific diagnosis. There was no specific finding. That's
Yeah,
why.
it's very tricky. It's very tricky to give the final diagnosis.
Is it
But I
right?
would say, yes,
Is
say
it
it again.
is it right? Autism spectrum disorder? Is it?
Yeah, it was autism spectrum disorder, and you did it very well. Actually, your doctor, your communication style and your asking questions, you were quite empathetic and uh, quite reasonably. You selected all your multidisciplinary team. That was really a very good selection. And there are few points I would like to go through with you. And like when you are explaining, asking about the family history, you ask like I will ask about the consanguinity. You have to like ask the parents, are you and your partner related to each other? So try to avoid the jargons
Yeah, sure.
during the history taking skills. And then the second thing is when you are actually explaining the history, you didn't mention about any regression. So try to, 4-year-old David who was brought by mom, there were concerns regarding the fine motor skills, and there is here it's better to say there is associated problem in the other domains like in socialization, in speech, and then after that, however, there is no history of regression. Try to be very selective and very composed about your words. You did it very well, and it was an excellent attempt. And I would say like it was a good station, and you can easily pass this station. But the problem is, I would recommend all the candidates try to take 12 out of 12 marks in this development station because this is the station where you can easily get 12 marks. Don't lose your marks because sometimes candidates are being failed by 1 mark or 2 mark, and that is really painful. So uh, try to be very focused in your selection of the words. And then when you were doing the examination, um, as I initially explained, like you should actually behave like you're examining in a real life. You should say, I would enter in the room, I will wash my hands, introduce myself, take permission, expose the child, make the brepo. There is a word mnemonic viper, that is the washing hands for W, I for introducing yourself, P for permission, E for exposure, and R for rapport building. And then you actually try to started examining the child, and then in the middle you said like I will check for the body build and everything. So it was, a jump from examination point of view. You were probably examining, letting the child assessing the child playing with the crayon, and then you said I will assess for the body. And so you should be very systematic when you are approaching for the examination. You can say like in the beginning, when you have done wash and the basic stuff, then you can see I will observe the child, what is he doing. I will observe for any dysmorphism, any hearing or visual aids, is there any abnormal movements, any gadgets there, is this child is on any wheelchair or anything like that. So after that, you can say like I will assess for the gait of the child. I would, is there any concern regarding the growth parameters? Is child short or head circumference is very large? You can ask the question to the examiner. Examiner would answer these questions happily. And then you can start your like, then you can say, I will come to the level of the child, get my toys ready, and then I will start examining the development, fine motor skills. And after that, your scheme for assessment was very good, and there was good memorization of the motor milestones, and you ask very relevant questions. The only one thing that I noticed, that when you are asking, making the shapes, you missed to ask about the cross first, because child was 4 year old. You asked, probably in the previous question you made an impression the child is 3 year developmental age, so you went with with the question of circle. It was better to be more systematic whenever you are asking any domain, you are asking about the crayon, you should ask about the cross, as child is 4 year, and then if child is unable to draw, then ask about the circle. And when examiner said yes, he can draw the circle, you can then stop up questions about the crayon. And am I clear?
Yeah, doctor, thank you so much for your
Nice.
feedback.
And but you did very well. I'm very happy with your, approach and everything. And another good thing that you did is you gave a range of the 2.5 to 3 year. This is what we were already discussing in one of the questions. And one of the colleague was asking like, how to give a range. Like you gave a range of 2.5 to 3 years. Definitely it is, you can't say 3 years absolutely. So you can give a range, that is very reasonable approach, and good clinical reasoning. And then you gave very good clinical reasoning. It's better when you are, when you finish your exam, I would be expecting like you instead of explaining the findings, you had some time. So if you just mention I would like to complete my examination by doing the formal assessment of the other domains of the development, formal hearing and visual assessment, reviewing the red book for previous health and developmental logs of the child, and then formal systematic review of the child and neurological examination. So that finishes your examination, and then just wait for the examiner. Examiner would ask the next question. Um, in the
Yeah.
description again, when you were giving the description, your description was fine, I would say. And then in the differentials, when examiner is asking differentials, don't actually try to give the reasoning in the beginning. Try to give one, two, three, four, whatever your differentials are, and keep, like you initially mentioned, some syndromes at the top, and then you mentioned autism spectrum disorder. So keep EST at the top, and then say some syndrome, genetics, maybe neglect, maybe environmental factors, maybe some genetics. You can then give a list that goes on. And investigation, when I ask about the investigations, to be honest, there are no investigations in the beginning, but you can say I don't think so. In the beginning, I would go for any investigations. I would do any detailed neurological examination, the formal assessment, and if there is need for any further investigations, I would discuss with my consultant. And as there is no dysmorphism or anything, there is no need to go for any microarray genetics or any metabolic workup. And in the management, it was a very reasonable approach by you. You involve the multidisciplinary team and developmental team and community pediatrician, social worker, and everything. The only thing you missed in the management is some, some you can arrange some financial support and some allowances that the child or family is entitled. You can add in that. And give a quick summary, quick, you were taking a bit longer time in telling the management. So I will involve my multidisciplinary team, this. Stop there. Then let the examiner ask the next question. Examiner would definitely ask you two, three questions about the multidisciplinary team. What is the role of occupational therapy? Occupational therapy would help the child to perform the activities of the daily life and promote the fine motor skills. Finish. Stop there. Don't tell the long sentences or anything. Then I ask you, what's the role of educational psychologist? And then you started as the child is having some behavioral problem. There's no need to, save even this one line. You can say the educational psychologist would actually help to establish some educational plan according to the child health needs, and they actually work with special education need coordinator and make a educational plan for the child. So very specific words and very pertinent. But I would say it was really a great attempt. And but there are few points that I discussed with you. That is just to give you some extra marks, just in case if any other station is borderline, you can easily compensate. The good thing for MRCPCH exam is like if you have some good marks in one station, you can compensate the other stations. All right, any questions from your side?
Thank you so much, Dr. Noor. Thank you.
Dr. Nadeem, I have a question.
Yeah.
Yes. I attend some workshops. They are now practicing in the developmental station initially, screening question, and then they are going to the next step, the main concern. Is there any update about that? Do you know?
Screening questions, you are saying, yeah?
Yes, initially they asking initially the screening question, and then they are going to the next step, main concerns.
So what sort of screening question? You have anything in your mind, like you just share with me?
Do you have any concern about do you have any concern about vision and hearing? Uh, how is the behavior? How many languages you are speaking at home? Is there any sign language?
Mm. So that is actually a very reasonable approach, I would say. Just, in the beginning, even on the first or second slide of the history, I said,
Like
like,
that?
if there is any
Especially in the UK,
established
they are.
health condition. Yeah, go on.
No, they are telling that now this is from the RCPCH that practice with the screening question initially and then the main concern.
Yeah, this is what I was saying. Like in the beginning, you can ask, like, is there any established health condition? But if there is a mother, just behave like you are sitting in your outpatient department, and a mother has come to you. What you will ask the first thing? What is your concern now? And then you can ask the screening question. It's nothing is 100% true or wrong. It's person to person based, but just behave like you are doing practice in your daily life in your outpatient department, and the mother has brought a child to you in the clinic, and you will just ask like, what is your concern? If is there any previous established health condition, any hearing and visual problem? And then you have to accordingly ask the questions. So it's okay both way, but I personally would suggest try to ask mother's concern in the beginning, and then you can ask about any screening questions. You can ask about if there is any hearing and visual problem or any other established health condition. But it's very reasonable to ask like, what is your concern? When did it started? Did anything specific happen around that time? Is there any other concerns regarding the development, any regression? And then you can ask few questions about the hearing, visions, about the spoken languages, about the screen time and all that stuff. Am I clear?
Thank you.
Very welcome.
Yes, Dr. Nadeem. But now in UK they are practicing like this. That's what I asked you to confirm with you.
That's fine. As I mentioned, like, there is nothing 100% true or negative, but you can go both ways. Um, you might have taken some workshop. Some of the candidates like this, but I have seen many candidates who got 12 out of 12 marks by this reasonable approach. So you're right in that way. I'm not saying that is wrong, but it's person to person.
Thank you, Dr. Nadeem. Thank you.
Thank you. Any more questions?
Thank you, Dr. Nadeem. You explained very well in a brief way.
Thank you.
Thank you, doctor.
Thank you very much. I think we should finish here. And good luck, all of you who are preparing for the exam. Some of you might be preparing for the first time, some of preparing for the second time. I wish you very good luck, and we will end the session here and see you again. Thank you.
It was a nice session, Dr. Nadeem.
Thank you, sir.
Thank you.